about it. And I want to make sure that we capture this history so that the HIV leaders that come after us, as well as ourselves, that we know this great history of this organ of this observance. So I'm gonna stop sharing my screen and uh, I'm gonna start with. Let's see if I can do that. Okay. I'm gonna start with Sam. Sam, I want you to introduce yourself. I didn't do it justice. I want people to know who you are. And just so you know, don't everybody write down Sam's email. Sam is retired, like for real retired. So I'm not gonna call on him every year, but I'm happy that he's here with us today. And Sam, if you can just kind of share a little bit of who you are and your history, and then I'm gonna ask you to take us back to 1999, that first National Black HIV/AIDS Awareness Day observance, and how we got to that place.
Sure. Thank you so much, Laisha. It is such a pleasure for me to be here and to reminisce about the origins of National Black AIDS Awareness Day. And also, it is a great pleasure to hear, Alicia, about your relationship with Dr. Mark Cologne, because he was key. And I will talk about that briefly. Um, but I'm Samuel Tavares, and I am a public servant. I have always um, thought of myself as um, someone who um, wanted to follow the steps of my dad, who basically dedicated himself to helping people um, to better their lives. And I developed great empathy. So I started my career in the Dade County Health Department, working um, as a counselor there, and worked my way up to administrator and then the center director. And I saw some of the first cases of HIV coming through. And I saw the stigma and discrimination and the neglect. And I struggled with that, and I challenged a number of the doctors there. And I remember one particular Cuban doctor who refused to treat. He was a dentist to treat a patient, and part of it was, after talking with him, was really just the fear of not knowing, you know, how to manage, the infection part of all of that. So I stayed there for about 6 years, and then I came to the CDC because I wanted to support community-based organizations, because I always felt, that a lot of the solutions and a lot of the action, a lot of the empathy needed to come, from the community, and that there was a lot of social capital in the community that wasn't being tapped. Um, and to me, that was really a great opportunity. Even at the health department, I felt like the community was not engaged, and the capital in the community, particularly nonprofits, were not in partnership with the health department. I thought that was a big, big deficit. So I stayed at the CDC, and immediately I was involved in putting out one of the major announcements for community-based organizations to be funded for HIV prevention. And that was a struggle, because there was the passion and the commitment, and the desire to do something about it, but folks didn't quite know, exactly how to do that. And as I began to provide technical assistance and to help organizations really tackle the infection rates and so forth, I began to work with national minority organizations, and had to define, their role. in the process of providing assistance, and it was really about capacity building. Some of them were even delivering HIV prevention in bars and barbershops, et cetera. And I was like, no, that's really the community-based organizations that need to be doing that. So I developed that program extensively, and then after about 23 years in HIV prevention, I went on to deal with larger public health issues, but also dealing with disenfranchised communities. Eventually, I developed the whole capacity building program across CDC, and then became the director for the Office of Island Affairs, which really dealt with disenfranchised communities with poor, very little resources, struggling, particularly places like, American Samoa and Guam and Micronesia and the Pacific. And it's amazing to know that these folks are all U.S. nationals or citizens, and yet they experience some of the highest poverty rates and highest obesity rates, and still have ancient diseases like leprosy to tackle with. So here I am, and just happy, to be part of this. I hope that gives you a flavor of, kind of my background. Thank you, Leisha.
Oh, absolutely, Sam. And thank you so much for sharing, because it gives us this long, rich history that you have from the states to the federal government, and just continued work with those of us across the diaspora. So thank you for that. So Sam, I want to take you back. It's 1999. You're a supervisor at CDC. What were the conversations that were being had that led to the development of, National Black HIV/AIDS Awareness Day?
Yes, yes. So I'll try to make this as brief as I can, because there's so much involved here, and you're bringing back so many memories, as I genuflect on all of this. But for some time, 97, 98, there was a lot of frustration about what was effective in terms of prevention, how to get communities involved, how to address stigma, because we know that stigma is a big issue, and a big driver, um, and so much more, including poverty and your zip code, where you live, etc. And one of the conferences, one of the National Minority AIDS conferences, the National Minority AIDS Council was one of the national organizations that I funded. Um, some folks got together and said, "Hey, we have to push for um, a political solution, because AIDS is a crisis in the Black community, and we just decades of seeing too many of our members in the community die and pass and suffer." Um, and that led to several key people like Deborah Hauser Frazier, Benny Prim, um, Paul Kawada, and others really pressure the Clinton administration to declare a public health emergency, national emergency, of HIV/AIDS in the Black community. That led to funding in 1999, and an initiative called National Minority AIDS Initiative. And then it was up to me and a couple of other key people like, Sam Dooley, George Roberts, Dr. George Roberts, Dr. Sam Dooley, and others, to kind of figure out, what would be the strategy. And of course, one strategy that I advocated for, because I always thought that apart from the community engagement, we needed, national minority organizations who had the bigger picture and had a whole history of civil rights work, and who had pull, with legislatures and others to be involved. So out of that, we carved out some funds and funded five national organizations. They were the Concerned Black Men out of Philadelphia. Lou Harris and Nicole Anthony were key players there. the late Lou Harris, National Black Alcohol and Addictions Council with John Robertson, Jackson State University with Dr. Mark Colon, Health Watch, which later became Health Power for Minorities with Dr. Norma Goodwin, the late Dr. Norma Goodwin, and then National Black Leadership Commission on AIDS with Deborah Hauser Frazier and to some extent Dr. Benny Prim. So these were the five key organizations. There were other organizations that later then became, adjunct to these five organizations. So one of the things that I felt always was a responsibility of mine was leadership and to make sure there was good coordination and making sure that there wasn't waste and making sure that whatever we did was effective and was a consequence and made a difference. So in a meeting that we held, and I had a great project officer, Steve, and Steve was just amazing. We held a big meeting in DC. And, I challenged these five organizations to work together so that there could be collective impact of the resources. And I challenged them to do something together. And, it went about and about and about. And then there was just this dead silence, like nobody knew what to do. And out of this faraway voice, I hear this very subtle, but, very firm voice that says, why don't we do Black AIDS Awareness Day? And that was Dr. Mark Colon. And I turned around and I said, that is a great idea. And people started thinking and said, yeah, we need to do Black AIDS Awareness Day. And so, Steve, took the helm and he worked with them day to day to really plan it out. And this was about maybe like October, November, and they got it together and they identified February 7th. And since then it's sprouted to many other things. Black AIDS Awareness Day led to Native American AIDS Awareness Day, Latino AIDS Awareness Day, Girls Awareness Day. And, it's really developed to a point where lots of folks have, you know, taken pride and done activities across the country. It's created awareness, it's created engagement, empowerment, and action. And I think it's really made a difference. And I'm so pleased that the infrastructure was put in place for this to continue to this day. So that's in a nutshell. There was, lots of personalities to manage, and there was lots of coordination, and guiding so that we can continue to work together to make this happen. But very pleased that we are here today. Over.
Oh, Sam, you made me emotional there for a moment, just thinking about something that we share all the time. And that is, can one person make a difference? Right. And just knowing now the history. So now no one has to leave unsure about how this started, the recommendation, where it came from. Um, and so I'm very honored, again, to have you here and to share it. I also want to give way for, because we are a small group, I want to give way for folks to be able to come off mute and ask any questions. And while you're trying to formulate your question, Sam, I have one for you. And that is, so you got these five organizations in the room. What made you select these five entities?
Right. Well, it was a competition. I had to put together a program announcement and define, the activities. First, identify the problem statement. And obviously, the problem statement was that, um, HIV infection was devastating the Black community, particularly Black MSM and Black women. And, the rates were disproportionate, at that time, and they still sort of remain, although we've had progress made, we were still hovering around, a 38% new infection rate, and so, so in putting together that problem statement and then identifying, key activities, and roles and responsibilities, et cetera, we put up a competition, and these five organizations, came on top. And and I really fought for us um, to fund these five organizations. Would have loved to have found it more, but there were others that, again, sort of assisted secondarily, but they, were receiving funds from my other initiative. But these five specifically were to work on the HIV/AIDS crisis.
Thank you, Sam. Any questions or comments for Sam? Well, while you're thinking about it, I'm gonna put that slide back up. And for me, there's a story that I see just with those five organizations. But I want to give you an opportunity to share what you see from these five organizations. What stands out for you?
I mean, I think for me, it's sure Washington's in the South. But just thinking of the traditional, you know, maybe geography when we think about Black people living with HIV. I think probably back at that time it was still predominantly maybe more counted in the Northeast. Versus the southern region, just thinking of like migration habits or whatnot. But I think that's one of the things that come out first. But it's just wow, like sitting here, hearing some of the names that have been called thus far, and thinking, there've always been a handful of people cornered in a room, saving the masses.
Thank you, Dr. Driffin. This is why you are my partner in health, because that was the first thing that stood out to me as well, looking at the geography of where the fabulous five organizations that started in Bad, where they were located. Anyone else? Other thoughts?
I think,
Just
I'm
go ahead,
sorry.
please.
Go ahead. Go
I
No,
ahead.
think
no, no, no,
that
no.
I'm still taken aback by how long this observance has been around. Like I had mentioned in the comments, I did not learn about National Black HIV and AIDS Awareness Day until 2020. And it was because I had started working for an organization that service people impacted by HIV, that I learned that. And I still work in public health, but my direct work is outside of this landscape, and even having conversations with people at work who are unaware of National Black HIV and AIDS Awareness Day. And I'm like, for God's sake, people, we are all in public health. Why has this been segregated even today from the public health landscape?
Thank you for that, Latanya. And also thank you for being that public health champion in raising people's awareness that this observance day exists. And what I've learned through the years is with the observance days, that's when we get the most traction, right? From media, from community organizing with events and partners where HIV is not their primary service. And so we want to continue to uplift that.
Yeah. just two comments. One is thank you so much, Doctor, for sharing that perspective. Because um, at that time, we felt that Jackson State University's participation was so key, particularly because we recognized that the Southern U.S. was particularly impacted even today. Um, Black Americans account for over 50% of the new diagnosis in that region. And so it's interesting that you would make that observation. And In terms of the last comments, Dr. Martin Luther King Jr. became dangerous when he saw the bigger picture, right? When he started to address poverty, not just beyond civil rights and our African American communities, the bigger issue here is poverty, it's income inequality, it's a zip code where you live, it's lack of access to healthcare services, it's lack of, you know, good education. It's divide and conquer. When he started to see the larger picture, that's when he became dangerous. That's when Malcolm X became dangerous, when he started seeing beyond, you know, um, the focus of white and black, when he traveled and came back and just saw that the issue was bigger. And so to that last comment, I think I think yes, there's definitely a need to target and to focus on the communities around HIV infection and other and lack of access to PrEP, which is still lowest among communities of color who need it the most. But it's also, these other major issues, that are impacting us. And so I think, we have to start thinking about comprehensive plans. Some call it the one-stop, shop. When someone comes in for, STD testing, but they also get HIV, but they also get, nutritional counseling, but they also get, um, other advice, for scholarships and for, other kinds of things. We have to start thinking about, comprehensive services. And not that you have to provide those, but that where you can refer and that you have a good perspective as to what social capital exists in your community and who you can go for different things. And people are passionate. You'd be surprised how many people are out there doing different things and are willing to lend their expertise or connect people. So that ability to connect, to be a convener and a connector, and a consultant is really, really key to help people, get ahead because it's just so much. And this is, you know, um, if you can keep people poor and and ignorant, for lack of a better word, and not accessing the services and not connecting and talking to each other, then these things will continue and they benefit a certain class of people. So we have to uplift our communities. We have to engage. We have to empower. And we have to help take action. Over.
Thank you, Sam. So, Dr. Griffin, Sam shared with us this rich history. I am still blown away by it. But my question to you would be, now where do we go from here, right? And how does MBAD play a role in that?
Well, I again thank you for having me on sharing space with Sam. It's been amazing thus far. I would be completely remiss if my comments do not start off by saying February 7th is also important to me because that's my mama's birthday. And I'm usually working on my mama's birthday because y'all got me on a webinar, y'all have me in the community doing something. So, it's a real give and take. But with that aside, I think we continue to, rest on everything Sam has said. We still see Black and brown people not benefiting from PrEP the most. We still see Black and brown people, when they do test for HIV, more times than not, they are testing later with HIV. We still see medical providers not listening to Black and brown people, not only about testing and prevention, but any health concern. So it really is the conversation of ensuring that the folks who are connected to people on these webinars know that A, we have to advocate for ourselves. B, we, have to bring all communities to the finish line. And C, like we could do it while uplifting each other and like really disrupting those bigger systems of poverty, of health issues, of housing status. So I think it all truly goes back to just creating a more holistic community that we want to be in. I had the opportunity also to share time with Dr. Cologne, and I will never forget one of the last trips he took. We actually went down to New Orleans to scout one of the hotels for the National African American MSM Leadership Conference on HIV and AIDS that was going to be in New Orleans that year. And I think I've always known, I wanted to be a doctor, but I think being around same gender loving men like him, like Dr. Leo Wilton, like Dr. Sheldon Fields, those were the people that really instilled not only in me, but in I say the folks that came around me in this sector that we really could do it, and now I'm an old girl now. To sit here, and truly do those things. It's just it's monumental. It's really monumental. So I'll stop there, Alicia.
Sorry, I'm on mute. Um, I want to pose a question, Daniel, not only to you and Sam, but also to the group. What do this next generation of public health leaders need to do to ensure that National Black HIV/AIDS Awareness Day isn't just about the observance, but it does become a catalyst to advance us to ending new HIV diagnosis in Black communities? And so, Dr. Driffin, I want to start with you and Sam and others. Please feel free to respond to the question either in the chat or come off mute and share your thoughts with our family as well.
I think one of the things that I've seen for the first time this year is like in bad week, you know. And I think it is truly lining up multiple activities, multiple touch points for everyone. I think of, as Sam was alluding to earlier, thinking about those larger engagements. Yeah, we could talk about HIV, PrEP, treatment, but we also be talking about that paired with ensuring like you have a voter's registration card, ensuring you know who your county commissioners are and why they are important, ensuring you know your city council members and demanding them to do their job, not only if you are paying a mortgage or rent, but baby, if you buy gas in a candy bar in a town, your taxes get to these people coffers at some point in time, and is creating the demand that, hey, we are watching you and you need to do more. I think about also connecting our HIV sector to other movements. A friend of mine now works at NAACP. That's how old I am. I say the letters, not the NAACP. NAACP. And recently they had a men's brunch here in Atlanta, and I told him, I said, now, if I come to this brunch and y'all don't mention the gays, like I'm gonna lose my shit on here, right? Because again, like if we are bringing communities together, we cannot forsake one member of our community.
Right. Since I didn't read a headline, I am assuming that they did mention the gays. I did. Okay.
They did.
Yeah, all right. Sam?
Yeah, I agree so much with what the doctor has said. My recommendation is that, and going back, Leisha, to what you said about how, one person, right, can make all the difference. And we know Margaret Mead says something very similar, right? Never underestimate what one person or small group of people can do to change the world, because indeed it's the only thing that ever has. Um, and so I think that there ought to be a movement to establish monthly regional health awareness and empowerment days. You know, um, uh, sim- you could narrow that down to monthly regional health awareness and empowerment days, for communities of color, or for African Americans. And I think that an organization needs to take the lead in creating a kind of a train to trainer program and support with materials, et cetera, so those can be established across the regions. And I think there should be 12 a year. And I think um, part of the emphasis is exactly what the doctor's saying, is being able to talk more than just uh, HIV prevention and PrEP, but to really talk about the determinants of health. How to empower your community to vote and to change policy, because policy is big. Um, how to access services, and how to do that well to benefit your family, and what services are available. And there are different key guest speakers that could be brought in with that expertise. And community-based organizations could be identified to play that role, in each region. There are 11 regions according to DHHS, but you may want to think about it differently. Um, and and I think they could be a committee, to bring those leads together, to plan together, and kind of, you know, um, um, just like, when you go to different churches, they follow a pattern of what theme should be spoken to, and what the scriptures are to support those themes, etc. So I would make that kind of suggestion, because I do think, if one only focuses on, you know, preventing the virus, from infecting someone, and not focus again on, you know, the dysfunctions in the family, the rejection in the family, and from the communities, the lack of access to health care, the education, the income, the jobs. If you don't focus on those things, and try to help people become whole in those things, then you're up against a huge tsunami. So that would be my suggestion moving forward. Over.
Thank you, Sam.
I'm
Sharonda, I
just,
saw that you come off mute. Yes, ma'am. Mhm.
Alicia, first of all this information is so amazing. I think that we have to, while we're destigmatizing HIV, we have to destigmatize HIV that it goes in one community, which is the LGBTQ community. And why I say that, I'm a cisgender woman, heterosexual woman, for those who don't understand that language. And we are still stigmatizing HIV in one sector. So, with that being said, and we have to meet the people where they are. What worked for us, I've been positive for 27 years. What worked 20 years ago don't work with the people now. We have our community who are fast paced. We have social media. Our young generation who they think fast. If you don't have their attention, they're gone. So I think with trying to in the epidemic and also bringing the community together, we have to learn how to learn how to stop stigmatizing HIV with a certain gender or a certain community. With the community now, with all this information in Black history, one of the things that I'm having issues with is telling heterosexuals or cisgender men and women that HIV involves them as well. And the first thing they think is, well, when I look at the commercials, when people talk about it, it's already stigmatized. So before we can do anything else, we have to also we have to also understand that if it's not geared to a heterosexual person, they're not going to listen anyway. And that's what I've been having to destigmatize in Florida. And if we're going to change different laws and if we're going to change different systems on how we reach different people, we got to change the way we think to be able to create an environment for all people that they'll know that it is important for them to come as well. If we're trying to recognize February, recognize HIV in the poor communities. The poor communities also include heterosexual women and heterosexual men that are not being, that don't think that HIV is geared to them. So we have to try to bridge that gap as well.
Thank you, Sharonda. And your comments, reflect what Sam was saying about we got to ensure that we're not leaving nobody behind in our community, and we got to create those opportunities and spaces to be true to that. I see in the chat, Latanya said she was about to say, let's expand from the day, the week, the month, making it more visible in the awareness and normalizing sharing knowledge beyond just the observance days. Very true, indeed. Other thoughts?
That was me piggybacking off of Dr. Drippin. When he started talking, I started typing. I was about to say that.
Oh. Well, we glad that you echoed it because it is true, right? Sometimes we gotta just continue to get that message out and get the word out. If we're still seeing and hearing people say, I didn't know that this was impacting our community like this, or I didn't know where I could get tested, or I didn't know, like a lot of the advances that have happened in HIV. I do want to share with you a group of organizations that have made a commitment that they will continue to keep the awareness day alive, regardless of what may happen with CDC or not. And bad does not have to go away. Not with all these leaders across the country, not with all these people committed to advance this effort and this work within our community. I want you to just pause for a moment as you look at this list. I want you to use your emoji if you can recognize one or more of these organizations, just as a way of being in solidarity that we will keep this observance alive. You heard the history from Sam. You heard from Dr. Driffin about what we have to do to advance moving forward. But I also want to give you the opportunity, leaders, that if you say, hey, I didn't see my agency logo up here, or I didn't see, or there's some other agencies that I love to reach out to have them here. Um, Take down this link. I will also put it in the chat. It's still time for them to submit their logo as we continue. This is my commitment from today, continue to not only raise awareness about MBAD, but also, as we saw this year, we didn't have a theme. We didn't get a theme, but that won't happen for 2027 because we can come together as a community and create our theme of what is important for this next level or this next phase of National Black HIV/AIDS Awareness Day. So, what I'd like to do as a closing, even though I'm posing the question first to Sam um, and Dr. Driffin, I want everybody to answer this. If you could give me one message to Black communities today about hope, about healing, and leadership in HIV, what would it be? What would it be? Now, I don't know if y'all waiting for the spirit to move here, but the
I had to
door is
think.
now open.
Yeah, I had to think hard about that. I would say that, with faith and perseverance, everything has a solution. We can overcome a lot of these barriers by working together and in community.
I think it was something Sam said earlier, and I wrote it down as he was talking. But I think I would answer to this. Black people are the architects for it all. If we put our minds to it and create it, everyone else come and adapt it. So, I mean, we just have to do that.
Janelle said, we can and will do better every day, every year. Other closing comments. Rico said, no one person can do everything, but everyone can do something. Rico, I strongly believe in that. Kenji, the only way out is through, and the only way through is together. Oh, now y'all know I gotta save this chat. You will see these quotes on the elder social media page, the Facebook. Oh, because they are so powerful. Yes. I see in the spirit of Jesse Jackson from Cornelius, keep hope alive. Yes. And
And
Cornelius,
and and we can't let Cornelius just like get away in the chat like that because my friend is over in Arkansas doing some things. So
yes,
friend, please come off of mute and like just give us a word or something, friend.
you on mute, Cornelius.
Now, thank you so much for um, I appreciate that, Dr. Driffin, and at least thank you for all of this and all that we've heard and its rich history about Black HIV Awareness Day. Yeah, that when you had that question, that's the first thing that came to my mind. In the spirit of Jesse Jackson and the fact that he has, transitioned, that we have to keep hope alive, and that for those of us who've been living with HIV all of these years, and especially myself, more than 3 decades and counting, I keep hope alive. That's just we keep striving here in Arkansas to try to do new and innovative things. That's just we keep here in the office trying to educate and outreach, and and we're excited about our new transition house that we just developed and how that's happening. So every day we keep hope alive, we keep struggling well, and we try to keep everyone informed about the possibilities and that the challenges are still great, but let's keep striving to do better and to know better and to keep other folks in the loop about what we're doing. So thanks so much for this opportunity. I really wasn't planning on saying very much. I've talked a lot over the years, so I'm trying to get my teammates to get more involved. They're also in the office with me because I wanted them to hear about how Black HIV Awareness Day came and let them know that there's a lot of history there and that all of this struggle, needs their awareness as the next generation, so hopefully in the next few years I can have a seat and they can take the wheel and drive us on home to continue to end HIV here in Arkansas and across America. Thanks.
Thank you, Cornelius. And we will hold true to keep hope alive. And the part two to that, because why? I am somebody, right? Tommy says, we've come very far, and our trailblazers should always be recognized. Each generation has new leaders, so the work continues. And Cornelius, that's just what you uplift, right? That even if some of us sunset and retire or move on, we should be building up that next generation of public health leaders or community leaders that continue with the work. Let's continue to normalize conversations about prevention, celebrate advancements in care, and stand beside those living with HIV with dignity and respect. I hope that I have captured everyone's comments. Sharonda, when Black communities unite, we create change. And I hope that you all are feeling the synergy and the love and the spirit and the way that I am. Um, I'm gonna let you close with that, Dr. Driffin, with your announcement. I will share this recording and the few slides that we have with you. That way, you get to share that history with others. Sam, just to say thank you was an understatement for you coming on out of retirement to tell the story. Now you got all of these community leaders that know now our history. In the words of Dr. Mark Cologne, now the question is, what are you going to do with it? Ensuring that our communities know what strong and rich history we have with this observance. Also to know that it was because of this observance that other communities got a chance to see and create and vision for observances within their communities. And Sam, I wouldn't have known that without you being present. And you wouldn't have been present if I couldn't connect with the greatest evaluator I've ever worked with, your daughter, Janelle. Janelle, come on camera for just a hot second. This is my shameless plug of evaluation that gets told from a community perspective. I'll put her up against any evaluator on the planet. She does great work, and now I get a chance to see where that community heart comes from. And so, Dr. Driffin, if you will do us the honor of your announcement and just close us out for today. Thank you all so much for sharing this space and time with us.
As Leisha has said, thank you, thank you, thank you. And I think, one of the last things I would say is just making a commitment to, and it's something that Cornelius just said also, and so many other
All right.
people. I dropped in the chat an announcement for the Creating Responsible Intelligent Black Brothers Fellowship, and it's a year-long social justice leadership development for young Black gay men interested in, or young Black queer men interested in, doing something at the HIV intersection. 19 through 30, but when I think about, the people who put me on this trajectory, it was crib, you know. So please, if you know anyone on your staff in the community who's interested in doing something, please, please, please share the announcement with them. The deadline is March the 27th, so they have a little bit more than a month or so. Yeah, so again, thank you for this, Alicia. Thank you for this, Sam. Thank you for this, Janelle. Thank you for this. Just continue to doing the good work of what we do every day of the week. So thank you, Alicia.
Thanks, everybody. Have an amazing day.
Take care. Mhm.